forsake you. All you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover. We learn to discover. We observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you. I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research. No need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show. It will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James. Hi, good morning, good afternoon, good evening. You are welcome to the Discovery Show here on YouTube, Facebook, Instagram, and Twitter. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in their own area. And basically, we seek to explore their lives and also learn from them based on their experiences, as well as learn the opportunities that exist in their fields. My name is Precious Adade Diodu, ably produced by James Kwabena Opon. Today is another opportunity to be speaking to another man. He's a postgraduate research student at the School of Geography and Environmental Science at the University of Southampton, UK. He's Mr. Winfred Dotse-Gborgbortsi. You're welcome, Winfred. You're welcome to the Discovery Show.
Thank you, Precious.
Great. Thanks very much for joining us. Please tell us a bit about yourself. Who is Winfred?
Thanks for having me. It's a pleasure to have your platform to have discussions this evening, morning, afternoon, wherever you are tuned in to us from. Yeah, so like you said, my name is Winfred. I'm from Hohoe. I was born in Hohoe. I spent most of my life there, schooling and my formative younger years in Hohoe. And then I went to school in Kintampo and then started working in the Eastern region, particularly Etiwa district, before it was split recently. So it was one big district. So I've been in Etiwa since 2008. Yeah, so I was actually there one day from closing from when the Etiwa showdown happened. Yeah.
That's interesting. Of course, for those who know that, I'm sure they might be laughing wherever they are. But tell us, Ben, I mean, you hold a Bachelor of Science in Public Health, of course, with first class from the University of Ghana. What is public health all about for those who may not know what that entails?
So actually, before the Bachelor of Public Health, I did Diploma in Health Information Management at Kintampo between 2004 and 2007, and which was my basic public health training. So I even understand public health from there more than my bachelor's undergrad degree. Okay. Basically, public health is about preventing disease and ensuring people live healthy lives. Not just ensuring they live healthy lives, but make sure that we give them information so that the healthy life is an easy choice for them to make and promote health. Yeah. So basically, public health is just ensuring that people are healthy all around us. And public health does not look at individual people like just treating individuals, but looking at the collective good of the population. So interchangeably, people also refer to it as population health.
Okay, great. When I had an opportunity to pursue an MPH, Master of Public Health, someone told me point blank that the program is too common. A lot of people are pursuing public health. In your estimation, is it good or bad? If you have a profession like public health and a lot of people are pursuing that, is that good or bad?
There is a popular proverb that too much meat does not spoil soup. So I think there is space for a lot of people in public health. As someone who studied public health yourself, public, you know that public health is very diverse. There is lot of things that people can do in public health in terms of health promotion, sexual and reproductive health services, nutrition, health information management, health education, health policy, health planning. I mean, there are a lot of diversity, a lot of things that people can do in public health. And even if you take just our Ghana context alone, if you go to most of the districts, I remember when I started work in 2007, I was one of the few technical officers in my district. So, which means I was handling tuberculosis, HIV, malaria, neglected tropical diseases, and all this stuff. I know things have changed. There are a lot more people in the system now, but still, you go to districts and one person does a lot of things. But public health needs specialty. People have to be focused and quite niche in what they do. So I think we still need a lot more hands on board to improve public health. And we don't necessarily just need public health professionals in the health service, but in other services, which creates that demand again. So you need public health officers at district assemblies to be advising people, assisting environmental health officers. You need a public health officer in fire service, the emergency services, all these institutions. When you talk about architects and building construction, you have to understand how structures should be constructed to meet public health demand. So, I mean, every corner that you think about, there is a need for a public health professional. So, we want more. Yeah.
Okay. So if there's someone watching us who might want to know what goes into being a public health, expert, in your capacity, like the work you did, what is a normal day's work like? What do you do? Do you only start working when there are outbreaks here and there, or what do you do specifically?
Because public health is a preventive service, we are working every day. Actually, our hope is that an outbreak doesn't happen. So it's not like public health professionals are waiting for an outbreak to happen. So every day we are looking at all the data that is being collected about people, about things that are happening, looking at the trends to try and forecast when the next event or epidemic or whatever disease outbreak could happen. And we are analyzing that. Apart from that, we are also engaged in routine immunization services for vaccine preventable diseases. So we know that we can prevent tuberculosis using BCG. They give penta vaccine, which is for diphtheria, pertussis, tuberculosis. Gone were the days when we were singing songs about 6 killer diseases.
Yeah.
Now we don't really hear about those 6 killer diseases. And these are all because of the efforts of public health guys who are working every day to make sure vaccines reach underserved populations, people are being catered for, people are educated every day. When a woman gets pregnant, there's a midwife who is giving health education every day, giving her the tips to keep the pregnancy safe, deliver in a health facility, and have a safe delivery for the mother and the baby. So all these are public health functions that are going on every day. For me, in my life as a public health informatician, I really look at the numbers, look at the data. So when I go to work, I look at all the coverage numbers that are coming, immunization. Are we doing well? Can we identify communities that we need to get more PAPs? If you look at HIV cases, are they going too high? We have thresholds and alerts for some specific diseases. So just basically to keep eye on the whole district and make sure that nothing takes us by surprise. Yeah. So that's my function in public health, but everybody have different roles they play.
Great. You spoke about having a diploma in health information management. What does
Yeah.
it entail, and what do you do as a professional in that field?
So I studied Diploma Health Information Management, and that's was a very broad course. Almost everything you can think about in public health, disease control. So basically, we studied together with disease control students. We learned a lot of stuff relating to disease management, looking at data, and then the added thing that we learned was database management, data analysis into more details, a little bit more of biostatistics, and stuff that would enable you to be more critical and analytical. So when you start work, you are posted to a district, and all that you do is to keep a very eagle eye on all the health data issues that are happening. And you also serve as a resource person because there are a lot of people, by virtue of their training, they were not given a lot of grounding in data management and the importance of using evidence for decision making. So as health informatician, you then become a resource person who trains all the other health workers in the district, sensitizing them, making them know the relevance of not just bringing you the data, but looking at the data themselves. Because we want to be at a place where every practitioner is looking at their own data and using it for decision making. So I basically support that kind of function and build people's competencies to make such build such capacity and use data for information for action. Yeah.
Thank you very much. Viewers, we are speaking to Mr. Winfred Dotse-Gborgbortsi. He's actually a postgraduate research student at the University of Southampton in the UK. I mean, a PhD student in this regard. And he's shared with us so far what he has been up to. Please leave your comment. If you have any question for Winfred, please drop that. We will ask him if that is relevant to our discussion. So, Winfred, I mean, we've spoken about the fact that you have a health information management and public health background. If there's anyone watching us who want to perhaps pursue any of these programs, what job opportunities, opportunities largely exist for them locally? If they are watching us in Ghana, Nigeria, wherever, and also internationally, what can they do with such degrees?
Yeah, so it's a very relevant degree, and there are lots of opportunities out there, both in the government and the private sector. You can work in districts, like I said, you can work in districts like myself, I did. You can also work in hospitals. So hospitals do have health information units where you can basically support the functions of a hospital, help them structure their data systems, and make sure everything is going on well at the hospitals. If you come to the private sector, it's also very relevant in there. In the private sector, you have NGOs. There are lots of NGOs, and the NGOs have different things that they do. There are NGOs who are into health information management. There are NGOs into reproductive health and different nutrition and different aspects of public health. And one key thing about NGOs, they do a lot of monitoring and evaluation. I think in the public sector, government, district offices, we focus more on the data management and decision making. But then if you come to the NGO side, it's more of monitoring and evaluation. So then you again need somebody in that seat who has a key eye for data, who can establish a baseline, who can help you do a survey, collect relevant data, establish baseline, and as your project goes on, they continue collecting the data, you evaluate, you compare it with your baseline, and then basically you help your organization make very sound decisions. So there are different opportunities out there. So apart from working in the public sector as a health information officer, I mentioned again M&E roles in NGOs. In NGOs, you could also actually work as a technical officer, trying to or supporting training of professionals in different other areas. So you could support professionals, training professionals. Let's say if the NGO focuses on training health workers, you could be a key person training people. if the NGO focuses on, say, distributing gadgets to health workers to help them collect data, as a health informatician, you have the expertise to actually do that. So when, after my master's in 2017, I actually worked as the M&E lead for an international NGO. And in that role, my work was basically the M&E lead, and I was performing functions of M&E. I helped do a baseline assessment for the organization. We started collecting information to measure our outputs. I helped with developing the project log frame. So, I mean, there's a lot that you can just do. The diversity is great. It's not just for health information management. I think it's a function of public health in general. If you hold a public health degree, it's quite limitless what you can do.
That's great. So I trained as a nurse in Ghana. I had to register with the Nursing and Midwifery Council in order to be able to practice. When I moved to the UK, I had to register with the Nursing and Midwifery Council of the UK in order to practice. What sort of professional registrations exist for someone who had trained, or who had pursued a Bachelor of Science in Public Health in Ghana, for example, and in the UK? Do you have any ideas of such professional registrations?
Yeah, so in Ghana, we have the Allied Health Professional Council.
Okay.
So the Allied Health Professional Council is where all of us as public health professionals are registered. So I have my registration with the Allied Health Professional Council in Ghana. In the UK, I know there is a kind of public health regulation also here. But I think because of how public health, depending on the function you play in public health, it is less likely that you cause harm to people than a clinician. So there is not too much emphasis on professional registrations and belonging to a professional body. But I mean, if you belong to the Public Health Association of England, it adds more credibility to your qualifications. But I am not sure in most jurisdictions you necessarily have to hold an accreditation before you can practice as a public health practitioner.
Okay.
Yeah, so in Ghana, I know about the allied health, but a lot of people, or almost all people who work in the private sector in Ghana, I'm not sure they are really registered with the Allied Health Professional Council. Yeah.
Okay. Great. You spoke about your previous work experiences in Ghana, working as, data information management officer and also a public health, professional at the district level. Generally, what sort of challenges do we have in our healthcare system across Africa? Perhaps, I'm sure because of your PhD, you have a broad, knowledge on all these, but use Ghana as a case study. What sort of problems do we have with our healthcare system?
If you broadly look at the health system framework, if you look at the building blocks of health system, looking at service delivery, the health workforce, health information systems, yeah, so you'd see that we are the only professionals actually in the building blocks of the WHO for health systems. So health information systems is in there. If you look at all those, I think there are about 5 or 6 building blocks. If you look at them, I think our biggest challenge is the financing, because you need money to support a lot of the things you do. And then you need money for logistics. So even places where you are talking about service delivery, there is logistics, medicines and non-medical supplies is also part of the health system building blocks. Even the health information system, building a strong one depends on the amount of money and investment you can make. So I think personally our biggest challenge is logistics. If you are ready to go and do immunization and then you don't have fuel for your motorbikes, you cannot go. If there's motorbike not available, you cannot reach rural people. So if you don't have cars to maybe travel over some really difficult terrains, you cannot reach people. If there are not ambulances, people will fall sick, they cannot reach the hospital early, especially let's say someone is giving birth and is having complications. and is bleeding, the person needs to reach a health facility in less than 2 hours. And there are some communities in Ghana that are so far away from these health facilities that even if they have a car, they cannot reach, or somebody will be in a traumatic position and cannot actually even get the car at all. So I think mainly it's about financing, getting enough money to improve quality, because all these different aspects that I've mentioned are related to quality. So having enough medical supplies, having a good referral system, having the logistics to work with both medical and non-medical supplies, actually even boosting staff morale is an issue there. Making sure that your people who are working in the health system are happy, they are motivated, and they are there to work. If you look at the framework for providing care, you have provision of care and experience of care. If you are providing care, you need all the medicines, supplies, logistics, healthcare work, and all those things to provide the service. But then when clients also come to the health facility, they have to have a good experience of care. So they
Yeah.
will be looking at whether you are mistreating them, whether everything that they need, they have it there. They don't come to the hospital and you say, we cannot do a blood test, go to a private facility to have that blood test done. Or you say, we don't have all your medicines here, you'd have to go elsewhere to buy the medicines. And once you are going elsewhere, the medicines become more expensive and they could even become inaccessible to some people. So for me, we have many challenges actually, but money can solve a lot of them. Yeah. Like people usually say, they say money solve a lot of nonsense. So money can actually solve a lot of our problems.
Great. So does the data, health, information management, does it include the management of patient health records?
Yes. Yeah.
Okay.
So health information management basically involves so when people come to the facility every day, let me
Yeah.
just give you a walkthrough. So when you come to the facility, people would have to access their records.
Yeah.
So then, in our case, a lot of people depend on the folders.
Yeah.
Yeah. So these are also issues of investment because we depend on folders, we don't have continuity of care.
Okay.
That is when you
Yeah.
leave one hospital and you go to another, you have to get a new folder, and then all your previous history is lost.
That's actually the direction of my question, that how difficult is it for us to digitize, health records of patients? Because like you said, here in the UK and any other developed country, it is very easy to retrieve patient records wherever you go.
Mhm.
But where we are coming from, they are hard copies, and sometimes it's even very difficult for you to locate it. And sometimes it even delays, patients' receiver of care, because at the end of the day, if the records are not retrieved, the patient cannot be taken care of. How
Yeah.
difficult is it?
It's quite difficult to some extent, because a good electronic health system, you can have the system working in one facility
Mm.
without depending too much on internet. But then once you have to start transferring information between hospitals, then you need a really good internet connectivity between them.
Okay.
If you attempt doing Zoom calls, sometimes in some health facilities or some parts of the country, you'd um, experience the difficulty of internet connectivity. So then think about transferring large health data between hospitals. So even the lack of universal access to internet connectivity is a big challenge for us having electronic health systems. I mean, the individual based ones that can be transmitted between hospitals. Apart from that, it also needs very key investment. You need to buy computers. You need to have a computer in front of almost everybody in every ward, in every consulting room, in every laboratory, at the mortuary. Every aspect of the health facility needs a computer. And then every person in those units, everyone has to be trained in using those computers, have to be trained in keying in the information. And I think it's quite intensive in terms of both investment, building capacity, and the time it will take for us to reach that level. But actually, we have improved over time anyway. When I started work as a health information officer, we were collecting our district-based information on basically Excel spreadsheets and Microsoft Access databases. So when at the end of the month, you download the database file and then you send to the region, and then the regional officer will wait for all districts to bring their records, and then they'll send to national. I think a few years later, that improved a little bit when we started getting used to emails, and then we could send some of these files through emails. And then later, by the key leadership of some of our very industrious leaders in the health system, I think particularly I'll give a shout out to Dr. Antonio Fosu, the current Deputy Director General of Ghana Health Service, who also happens to be one of my PhD supervisors anyway. Yeah, so he has been key in transforming health information system in Ghana from that access-based standalone computers where if your computer crashed in December, you'd have to re-enter all your information from January to December. It has happened to me before, so I know the experience. And then he brought in a system which was developed by the University of Oslo called the DHIS, District Health Information Systems. And then we started keying in information at the district level, and then you don't need to travel with your information. And the information, once you enter the district level, the region has it, national has it, everybody is having access to it. And then also health facilities are actually now inputting their individual information too. But this kind of information is more of aggregated. So at the end, you have a form that has number of people who had malaria, people who gave birth, whether they were low birth weight, number of snake bites, and all the information that you can think about that we collect. They report it in aggregated form. But where we really need to reach in the future is to document individual information of patients, because that will become richer, and then we can get more information from that.
Thank you very much, Winfred. That's extensive. Please leave your comments, send in your questions, and we'll definitely ask Winfred. So Winfred, lastly on this, it seems the way forward, basically, it's all about money. Are you saying if we have all the money we need today, all the problems we have for our healthcare system, especially from your side, will be solved?
Yes, I think it will be, the investment will be great. I mean, if I say money in general, it's not like it's the absolute solution, but if you have enough money, we'll build better health information systems. We'll train more health workers. Currently, there are actually more midwives in Upper East and Upper West per capita than the rest of Ghana. I'm sure you will not believe that. You think there are more midwives in Accra and Kumasi than Northern Ghana. But actually, in Upper East and Upper West, there are more midwives than the rest of Ghana. But on the flip side, there are less gynecologists and obstetricians in these areas compared to the other parts of the country, which means that when there are any emergencies, obstetric emergencies, women are more likely to die in these areas because they do not have access to cesarean section, blood transfusion, and all this great care. So money in terms of investment, if we are able to train enough doctors and motivate them enough to stay in some of these rural or poor settings, it will improve the lives of people. If we have enough money, we'd make sure that all our pharmacies in hospitals are well stocked. All the medicines that we need are there, the supplies are there. There are many times we've heard on the radio that my wife was ill, she was giving birth, or she was having this issue. We were asked to buy this medicine, it wasn't available, and we had to search at several places. Even personally, I had such an experience where my mom was going to have a surgery, and then they prescribed medicine for her at Ho Regional Hospital. And I had to travel, and they couldn't find the medicine. So I was roaming about. I finally got it in somewhere in Eastern region, actually by help of one of my directors who happened to own a pharmacy himself. So it was just his own private pharmacy that was able to save me. And then he gave me those medicines, and I quickly traveled to Ho with it. But this shouldn't be happening in a country, especially as Ho is a very big regional center. So you see, if we have enough resources, we would plug many of the gaps that we have. I know our human resource is really great. Look at you yourself, a product of the system. Myself and all our other friends who are watching us. We have really great capacity. We have the human resource there, but then we just need the tools, and then we just need to be empowered to work. Yeah.
Thank you very much, Winfred. And to our leaders, please make judicious use of the scarce resources we have. Don't misuse them. Thank you.
Meet Mr. X, an unhappy businessman who has been waiting for days for his goods to be delivered. Unlike Mr. X, business is booming for Mr. K because of his efficient partnership with Hembeck 60 Hub, also known as HP 60 Hub. We are an online platform that sources for goods from across the globe. We only pull high quality standard products from anywhere in the world and ship them right to your doorstep. Be it watches, clothes, bags, and many others, do get in touch by contacting us on www.henbeckagency.myshopify.com, or you can call us on +233 546 022 952 or hembeck@gmail.com. Hembeck 60, truly a world of endless possibilities.
Thank you for sticking and staying with us here on the Discovery Show. Here on the Discovery Show, we say yearn to learn. We just explore people's life. We want to know what their journeys have been, learn from their experiences, and also explore the opportunities that exist in their field. So that perchance, if you are watching and you may need that opportunity, or you know someone who may need that, you will definitely be able to access that opportunity. We are speaking to Mr. Winfred Dotse-Gborgbortsi. He's actually a PhD student at the University of Southampton. So let's talk a bit about your PhD. Tell us about your PhD. What is it about, Winfred?
Yeah, I think I've been speaking a little bit about that already without actually mentioning it. Yeah, so I research maternal health, watching women die by virtue of our system. What happens is it really saddens me, and so I went into the PhD with the objective of contributing to the system to reduce maternal mortality. And to do that, basically I'm looking at the impact or influence of travel time or proximity to maternal health services and the quality of care we have in health facilities, and how this impacts where women choose to give birth across particularly Eastern region. So I focused on the region that trained me and kept me working. So not because I just wanted to focus on Eastern region, but I think the project is quite huge. My study writes the whole region, so 33 districts, analyzing data on about 50,000 women. So if I wanted to scale that up to the whole country, I think I will finish the PhD by the time Jesus Christ comes back. So I had to be quite snappy and be tactical about it. So I'm actually researching only the Eastern region and doing all things relating to maternal health. But I've also written a couple of papers concerning maternal health in the whole country itself, and some outside Ghana, in Nigeria and other locations. Yeah.
Great. So what are you researching into? I mean, you've just given us a snippet of that.
Yeah.
What do you aim to achieve? What are you seeking to contribute to our healthcare system at large?
Yeah. So usually when people do research, a lot of our research depends on survey data.
Yeah.
So like large surveys like demographic and health surveys, um, multiple indicator cluster surveys, Ghana Living Standard, all surveys that you can think about. But the key thing about my research is that I'm actually using the data we health information officers and health facilities collect in Ghana. So
Okay.
I am developing methodologies around our own routine data. And why this is critical is because survey data is expensive and it's also not always available
Yeah.
because people, it's an investment. Usually it's people who invest, international agencies pay a lot to carry out these very large surveys. So you might have one. The last time we had a DHS in Ghana was, I think, is it 2014? Yes. And then there was a special Ghana Maternal Health Survey in 2017. So even between then and now, you'd see that a lot of things could have changed. But then the health facility data is there every day. It's being collected. As we are speaking now, there's somebody in the facility saying, "Oh, I'm ill today. I have headache. This has happened to me," and all that data is being collected. So if you develop methodologies around that, it's not just useful for academic purposes, but day-to-day health information officers in Ghana and the health workers, health managers can use these methodologies and apply it every day to improve the decision making in our health facilities. Decision making, like where should we site health facilities to better meet people's demands. So that's one really critical aspect of my research, using health data for information, for research. I think another key aspect of the project is actually quality care. So as part of the survey, we did a census. As part of the research, we did a census. And a census is different from a sample survey. So we went to every single health facility in Eastern region that provides maternal health services, or actually that receives births. Yeah, because there could be places that provide antenatal care, but they don't really have midwives to provide birthing services. So everywhere, so we went to more than, or approximately about 160 health facilities across the whole region, and we collected every kind of data that you can think about. Give an example. Let me see if we collected that or not. I can tell you off head. What do you what do you think we collected or we didn't collect about maternal health?
Of course, I mean the number of births per person.
Yes, we collected that.
Okay.
Whether there is a pathograph, whether they are
Absolutely.
using pathograph, whether they have ambu for resuscitation, and
Yeah.
whether they have a resuscitation bed, how many delivery beds are there, how many
Okay.
midwives are there, do they have water, is the water flowing every day, which emergency obstetric care signal functions
Mm.
do they perform, what are their referral systems, do they have
Okay.
an ambulance, if there's an ambulance not there, what do they do? So basically, even the data we collected without any, let me say, rigorous analysis, just
Mm.
putting it in front of district and regional directors in Eastern region, they are able to know where to make interventions. So it's that
So
kind of
just to
impact that we do.
clarify, was it data just on the health facilities, or that includes patients as well?
So data on the health facilities, and
Okay.
then data on the patients.
Okay.
So
Okay.
on the patients, we looked at the delivery registers and
Okay.
deduced from there where did the patient come from
Mm.
before coming to give birth. So
That's right.
because we know where every patient comes from, that's their origin, and where they gave birth, we're able to calculate the travel times.
Mm.
So for every single woman who gave birth in the region, we know how many minutes she traveled to reach the
Okay.
health facility.
Okay.
So then,
Based on the initial analysis and all that, are you able to tell us anything specifically that you think we should pay attention to with regards to our maternal health in general?
yes, yeah. So actually, we have a lot more women. So the World Health Organization says that women shouldn't travel more than 2 hours to reach a facility that can actually provide them cesarean section and blood transfusion, in addition to some other critical core services.
Yeah.
Within that time, I think only 4 out of 10 women, not I think, actually presented this in a conference last week. So it's not guesswork, it is proper evidence. 4 out of 10 women have access to this kind of critical care.
Wow.
So it means when a woman has complication and then is bleeding and has to reach the nearest health facility that can give cesarean section and blood transfusion, only 4 out of 10 women can reach. But
That's
on
serious.
the flip side, it's serious. Yeah, it means the rest of the 6 women can die.
Yeah.
That's how mortality rate is still high. But if you look at generally, just travel to any midwife or any place where you can give birth. If it's not a complicated birth, 8 out of 10 women actually travel within the 2 hours. So that is good. But good is not good enough. We want the best. We want a lot more women to have access to the comprehensive emergency and obstetric care services. And actually, if you look at the health facility situations too, I think if you even cast your mind to your own region or any location in Ghana, you just see that urban areas have 2, 3, 4 hospitals. And then if you go to the rural areas, it's just health centers and chips. So there are a lot more, but then there are a lot of women in these rural areas. So the special distribution of emergency care is disproportionate to the disadvantage of rural women. Imagine a rural woman who is actually has a complication and has to travel to an urban center. She's also going to incur indirect costs because a family member has to accompany the person. The family member has to find accommodation somewhere in the urban area and be sleeping. Will be paying for that, feeding themselves, travel. The cost of transportation is more. So things are even easier for the urban dwellers than the rural women. Let me give you another key one. There's one paper we have under review right now, which we looked at when women themselves say whether they have challenges traveling long distances or not. And then when we actually calculated their travel times to the nearest facility, urban women who said they travel far, the distance they travel far is shorter than rural women who said they don't travel
far.
Yeah,
Shorter, isn't it?
yeah, it was on the flip side.
Yeah.
So actually, you can say maybe there is traffic and the rest in urban areas, but still it just shows how much rural women are struggling, and we are putting a lot more strain on them to access quality care service, which to me is very unfair.
Thank you very much, Winfred. I mean, these are food for thought. I think there's still, of course, we've made some significant strides when it comes to maternal health generally, but there's still a lot to be done, as you've rightly said. And I'm sure we all have to put hands on deck to ensure that we do our best. Tell us, how did you find your postgraduate studies, both masters and PhD? I know you have 2 masters and then a PhD now at the moment. How did you find them?
Yeah, airing me now. So I paid for my school at Kintampo. I paid for my degree, bachelor's degree at Legon, and after that I've not paid for any of my other degrees, which I'm very grateful for. So my first MSc was in applied GIS and remote sensing. So GIS is Geographic Information Systems. All the description I just gave right now about travel time, accessibility, and stuff is what you learn in GIS. So basically, you look at the relationship between place and health. You know, when you define health, we talk about person, place, and time. Yeah, so the place component is GIS.
Okay.
So the GIS MSc was sponsored by the Commonwealth Scholarship Commission, which I studied between 2016 and 2017. So I spent that one whole year looking at how to use place-based technology to improve analysis of health data and make meaning. What the great thing about GIS is that it helps you unearth or unpack inequalities, geographic inequalities, which is really great. So that was about the GIS and remote sensing MSc. After that, I worked for a year with Ghana Health Service again in Good Neighbors, Ghana. And then I came back to the UK for my PhD. And my PhD is funded by the Economic and Social Research Council. So they have different streams of funding. And the one I was offered.
Spend some time to talk about that and give people some tips. How do they apply for that? I mean, some tips to help them to put in a successful application as well. So go for it.
I think you have talked a lot about the Commonwealth previously on your
platform. Why no one has to talk about it. So talk about the economic.
So you see, I've been listening to you. Yes.
Thank you.
I'm one of your secret audience and admirers. So I've been listening to all the discussions. Yeah.
Fantastic.
So,
thank you.
So for the ESRC, I had the 1+3. So the 1+3 funding actually is a combination of an MSc for 1 year and a PhD for 3 years. So the 1 year you study social research methods. So basically, the objective of the ESRC is to train well-rounded social scientists. So then they want you to have a background in qualitative research, quantitative, and mixed methods and all-round, which is really great. So then I had that all-round training in that MSc before I started the PhD, because I was more quantitative biased. So I had the opportunity to learn both mixed methods and and qualitative. And so for ESRC, I think a few years ago, there used not to be a lot of opportunity for international students. But recently, they have changed their regulations. And I think they found about, I've forgotten the percentage, but there's actually a percentage allocated for international students. And in this case, I'll qualify that I think international students now includes everyone else apart from the UK. So including Europe because of Brexit. So Europeans are also now sort of international students, I think. So there is that portion left for international students that you can compete for. There is no centralized point of application.
Okay.
Let me just sip water a little bit.
That's fine.
So there's no centralized point of application for the whole ESRC. So they run what we call the
Can you say the full name again? The full name again.
Economic and Social Research Council.
Okay.
Yeah, Economic and Social Research Council. So there's no centralized application center for ESRC. Basically, they have what they call DTPs, and that's Doctoral Training Partnership, and it's a group of universities. So the one I belong to is called the South Coast DTP. So if you search for South Coast DTP on the internet, you find it. So for the South Coast DTP, it includes Southampton, University of Brighton, and I think University of Portsmouth.
Okay.
So you can apply.
Is it for only PhD funding? Is it only a PhD funding?
Yes. So the ESRC trains social scientists, research scientists for the whole UK. Yeah. So it's only PhD funding. They don't do MSc. If you are taking an MSc, the MSc actually comes as part of your PhD. Like the social research methods that I did, it was part of the PhD package. Yeah.
So does that mean that if you hold it, so I mean you had a master's before you applied for this? Does that mean that someone with just a bachelor's degree can apply for that straight away? That's the 3+1 or 1+3?
Yes.
Okay.
Someone with a bachelor's can apply.
No masters, you can apply for that, isn't it?
Yes. Yeah.
Okay.
The only thing I might think about is, maybe the comparative degrees in different countries.
Okay.
So having that faith in people to offer them a PhD funding straight from undergraduate, it's quite a little bit more strenuous. Yeah. So I think if you're actually holding a master's already, you stand a better chance.
Okay.
But most of the people who are admitted, especially in the UK, most of them come straight from their undergraduate, and
Okay.
then they take the 1 year masters and then continue with their research. So if
Okay.
you go to any of the DTPs, if you search, I think if you go to the ESRC website, you see all the different DTPs or doctoral training partnerships, and then they all have websites. So it's on their individual websites that you can find their application form and then apply. I think the applications start quite early, and then you submit your application, your references, and everything, and then they screen them. And somewhere in April, May, they give the results and say who they are going to fund or not. I I I can say it's one of the really competitive ones because it's what the UK uses to train their own research scientists. I
Okay.
mean, social scientists. Yeah. So the emphasis a lot is on home student, but the percentages that they give to the international students is also really competitive because then you are competing with the rest of the world. So yeah. But
Okay.
it's a really great funding to have because it gives a lot of training. I mean, there are a lot of opportunities in there for people to learn, network, and build capacity.
Okay. So if you talk about it start really early, you mean January, early part of the year, is that right?
Yes, it starts really early. Yeah,
Okay.
yeah,
So what I got from you is that you just go to all these websites you've mentioned, search for that, go
yeah.
there, apply for the scholarship. Is it applied together with the program of study, or you need to apply for them separately like the Commonwealth?
Yeah, you need to apply for them separately. And
Okay.
then let me just also mention this in addition. So because they are the that particular funding is solving generally UK problems, let me
Okay.
say it that way, they have designed projects. So almost 95% of the students would have just selected a project that has been designed,
Okay.
but then there are a few opportunities for you to come in with your own project.
Projects.
Yeah.
Okay.
So in my case, I developed my own project, and that was what I submitted as part of my proposal. So in my application package, I wrote my abstract, had a few references there, and said what I want to do, how I want to do it,
Okay.
expected outcomes, and stuff like that. Yes. So I think a lot of international students can explore both options. You can go in for an advertised project, or you
Okay.
can actually develop one yourself. But a lot of times, the advertised ones, they might just say it's for home students. So
Okay.
if you are developing yours and coming in as an international student, I think it makes a lot more sense.
Okay. Beyond having your own project, what other things do you think made your application successful?
I think for PhD applications, you just really have to demonstrate ambition and the
Okay.
fact that you are ready to learn. After finishing a PhD, being a professor, and not that I am one, but observing my professors and observing friends who are very really high in the academic area,
Yeah.
you'd realize that every day they're ambitious, they are more curious, they want to learn, and they accept that they can always learn and know more. So if you show that kind of curiosity and drive that, you know that there is room for you to improve, to learn. Yeah, I think that's what's really needed.
Okay. Great. Great. Thank you. Thank you. But beyond what you've said, what are the, because of course you have great experience. You have two masters now and you're almost done with your PhD. There are people
Yeah.
watching us who want to pursue a postgraduate studies, either masters or PhD outside the country. What other things will you say to them so that they can prepare themselves and put in a better application? What tips do you have for them in addition to what you said?
Yeah, I think apart from the ambition, you also just to say, I am acknowledging Irene's comment. She said I'm one of the pros, but
I've seen
there's there's a disclaimer on that. Yeah. So I think apart from the ambition, you'd also have to demonstrate some level of skill, because PhDs can be sometimes lonely. It would be difficult, no matter how very skilled and talented you are. And so, for you to demonstrate that you can be resilient, for you to demonstrate that you can write, so having pieces of work that you can show, even if you are not able to publish a paper, but then you have written some really good reports, demonstrating that you can have critical appraisal of documents. And so even if you are just writing blog, it's not a scientific piece of writing, but then you bring thoughts from different people, different angles, compare and contrast. So these are things we call like transferable skills, things that you are supposed to learn in your undergraduate or masters. And if you are able to demonstrate this to anyone who is assessing your work or your application, then the person, I mean, even if you are asked to bring a proposal, and in the proposal, you maybe you are writing about sampling, and you don't really calculate that I will sample 1,000 people, but you tell whoever is assessing that I know that this research needs maybe a convenient sampling approach, because many people say random sampling is good. So somebody might want to say, I'm going to use random sampling approach, but let's say it's maybe purely a qualitative research, and the best approach might have been a convenient one because it's a rare situation that you are going to assess. So just having some of those basic knowledge and demonstrating that I have a certain level, that if you take me on as a student, I can improve on it. I think it makes a big difference. I think for me, I'll just give an example again. When I was being interviewed for my PhD, I was asked about how would I take on criticism.
Okay.
And then I just thought about it, and I said, oh, when I was finishing my undergrad, I had the opportunity to publish a paper. And then in that particular paper, which was published in 2015, that paper has on it my two of my current supervisors, one of my professors at Legon, Dr. Bosompra, and then the current Director General, Dr. Abuaji, was also on that paper when he was the Family Health Division head for Ghana Health Service. And these people, except me, were criticizing each other. I mean, like they were comparing and contrasting their thoughts. This one say, let's do it this way. This one say, oh, this might be a better approach. So in that interview panel, when they asked me this question, this was the example I gave. I said, I have observed professors criticizing each other. So if I start my PhD and professors are criticizing me, I think I'll just smile at it, because even at their own level, they are criticizing each other. So one to me will say, whom am I? So you see, if those people are criticizing each other, then as for me, who am I? Yeah,
Ali, thank you so much. One thing I can say from all you've said is you're a very connected man. It's been a pleasure speaking to you, to Hazi. It's been a pleasure.
Yeah, that's what my friends call me.
yeah, certainly. Any final words for us, Winfred? Unfortunately, we're out of time. Any final words?
Yeah, it's been a really great pleasure being with you, sharing the time here, and shout out to all my friends who are listening and watching us. I would just say that everyone has something great in them. You just have to discover what it is that you are really good at, and focus your energy on sharpening what that thing that you are really good at. And we all have limitless abilities, but then we have to take the opportunities that come, because the opportunities may come, but they will not keep there for long. When they come, you have to be prepared. If you are not prepared, you cannot take advantage of those opportunities. So if you identify what you are good at, keep pushing at it, make yourself great at it. One day that opportunity would come, that you just know that this is the best time for me to take it, and yeah, let's all be great. Let's all be great.
Fantastic. Thank you very much, Winfred Dotse-Gborgbortsi. He is actually a PhD student at the University of Southampton here in the UK. He's a big man, as you heard. A very well
Precious, you are bigger. You are bigger.
A very well connected, a well-connected man locally and internationally. So I can see, I mean, a number of people watching. Thanks very much for watching. Jessica, Ashley, Irene Bossman, Emmanuel Ekbo, thank you. He says my costume is purely African and he likes it. Thank you. Godfred Ohene, Justice Yevuga, thank you. And every other person who is watching. My own wife as well, Josephine Abuajimisa. Thank you very much for joining us. This is the Discovery Show TDS TV here on YouTube, Facebook, Instagram, and then Twitter. Basically, what we do is to explore people's life. We want to know their experiences, what their challenges, and also their successes have been, so we can celebrate them. And beyond that, we also want to know which opportunities exist in their field, so that if you need that opportunity, you can go that path or you can recommend it to someone. Please subscribe to our channel here on Facebook, YouTube, Instagram, and Twitter as well. The name is The Discovery Show TDS TV. I have been produced by James Kwabena Opon. My name is Precious Adadidiodu. I have been your host, and it's been a pleasure having you here. Thank you so much, Winfred, for honoring our invitation, and we hope to catch you sometime in the near future, of course, in the near future. Thank you very much, Winfred, and thanks very much, dear viewers. Have a lovely evening, morning, or afternoon, wherever you are.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermine me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.